Your Excellency, the Deputy President of the Republic of Kenya, fellow Excellency Governors, CS Deborah Barasa, Cabinet Secretary for Health, Principal Secretaries, CCs for Health and other officials present, stakeholders in the healthcare sector, distinguished ladies and gentlemen, good morning. I'm honored to join you here today, Your Excellency. Today's meeting provides a platform for us to jointly discuss, learn, innovate, and share experiences on health by fast-tracking our journey towards universal health coverage. Additionally, meetings like this will foster intergovernmental coordination and cooperation, thereby making the national and county governments to be more effective and efficient in their roles. In this regard, allow me to take this early opportunity on behalf of the Council of Governors and on my own behalf to thank you all for attending this forum. Your Excellency, ladies and gentlemen, for almost a decade now, county governments have contributed tremendously to the healthcare of our people. Devolution has significantly empowered counties to tailor healthcare services to local needs, making healthcare more accessible and responsive to our communities. Whether you look at the northern frontier counties, which had unique health and development challenges that were related to long-term suboptimal resource investment, or you have a glimpse at cities like Nairobi, Mombasa, and Kisumu that have their health needs stand out because of the large population concentrations in small areas, you will not fail to acknowledge that the progress that devolution has brought to the Kenyan healthcare sector. Each one of you has played a unique role in realizing these gains. Despite these gains, there are pressing challenges that require our collective effort and collaboration to overcome. Allow me, Your Excellency, to highlight just a few. And one, the transition of services in social health insurance. First and foremost, there are a limited number, precisely 5,380 claims processing devices in counties. In addition, there are frequent system downtimes and inadequate e-claims machines, hampering efficient claim submission and reimbursements. Expanding the device distribution and improving system reliability are essential for streamlining financial flows and enhancing service delivery. Secondly, there has been delays in implementing capitation for the level 2 and 3 facilities, creating financial instability. Timely capitation payments will provide predictable financing for these facilities and ensure continuity of service. It's important at this point to note that counties are owed Kenya shillings 7.5 billion in unpaid NHIF reimbursements, which is severely compromising their service delivery. Immediate settlement of these debts is critical to restoring financial stability. Thirdly, the primary healthcare fund and the emergency, chronic and critical illness funds need to be fully operationalized. Your Excellency, the National Equipment Service Program, NESP implementation, is another matter we would like to discuss. The implementation of the NESP as a fee-for-service model to replace the Managed Equipment Service, which was commonly referred to as MES, prevents an opportunity to enhance access to specialized services such as renal care, radiology, and intensive care. However, clear guidelines and sustainable financing mechanisms are required to ensure counties can manage and sustain these services post the contractual period. The impact of the US government's work order on health services is another challenge. The recent stoppage of work order by the United States government has exposed our over-reliance on external donor funding for key health programs. This order has significantly affected critical services, including HIV, malaria, TB, family planning, and immunization programs. For example, about 11,000 healthcare workers who are financed by the US government across the country have been affected, threatening service continuity in both public and private facilities. There has also been disruption of the health management information system, particularly the Kenya EMR system, which is crucial for managing HIV data. The loss of funding for HIV commodities can be estimated to be around 13.5 billion shillings annually. To address this, we must take decisive action to integrate donor-supported systems into our health system and ensure sustainability. We must also prioritize domestic resource mobilization to reduce our dependency on external donors. The healthcare workers' industrial unrest is a perennial challenge. It's a pressing issue that's unresolved. That is the labor concerns within the healthcare sector. The delayed implementation of the return to work formula and the incomplete absorption of UHC staff into permanent and pensionable status have led to significant unrest among healthcare workers. This poses a serious threat to service delivery and continuity across the country. We must urgently address these labor issues to ensure a stable and motivated workforce. Last but not least, community health promoters funds flow. Your Excellency, this still remains unresolved even after several resolutions of the summit and the IBEC. The CHP is the lowest level of service provision. Hence, to ensure consistency and accountability of resources, a conditional grant was to be granted to counties for the counterpart funding from the national government, the matching fund from the national government, to ensure synchronized payment point. Your Excellency, ladies and gentlemen, as a Council of Governors, we knew that the implementation of universal health coverage will not be without challenges. But we believe that beyond the teething problems, the average Kenyan will be better for it with regard to access to health care. The challenges facing our health sector are indeed complex, but they are not insurmountable. Through structured collaboration between the Ministry of Health and county governments, we can build a resilient healthcare system that serves all Kenyans efficiently. I urge us all to approach today's discussions with a commitment to finding practical and sustainable solutions. Let us work together to make affordable and quality healthcare a reality for all our people. I thank you, and may God bless us all.
Makofi mazuri jameni. Asante sana Mheshimiwa Abdullahi. Kwa ruhusa yako Mheshimiwa Naibu wa Rais, nikubalie ni mwalike waziri katika Wizara ya Afya aweze kutuelekeza katika